Hi everyone, how are you doing? So if you're thinking about having dental implant treatment, you're thinking of replacing a full set of teeth with dental implants, you're going to be going from website to website and you're going to be trying to compare not only prices but the quality of the end result that you're going to get. Now a lot of businesses know this, a lot of providers who provide all-on-4 treatment will know this, and they will put out marketing material, let's say, and metrics about the products that they provide, and a lot of it doesn't actually mean anything. So in this video I want to kind of open your eyes to some of these things which are very popular metrics, for example the number of implants or the number of teeth that you promised. And I want to show you how, first of all, nobody can actually promise this from the outset, but what a better metric to look at actually might be. So let's first start with the number of implants. A lot of places will say all on 4 or all on 6, all on 8 I've seen, but the actual number of implants isn't really very important. And in fact, the number of implants is dictated by one, bone availability, and secondly, what is appropriate in your situation. So I've done a video on kind of the different classifications of bone in the past, but it's a little bit technical, so let me simplify it for you here. We've got situations where if we take what's called an OPG x-ray, and it's kind of like an overview x-ray showing the bone that you've got, and let's look mainly at the top jaw because this is where the variation occurs more often. And we've got situations where we've got almost zero bone, and then we've got situations where we've got enough bone typically for implants, and this is the most common bone distribution. And then we've got situations where we've got so much bone we just don't know what to do with it, and our implant orientation in each of these cases is going to be different. And in the all-on-4 case, you can see we've got these tilted implants towards the back, and that is basically to get the head of the implant as far back as possible. Where we've got loads and loads of bones, we can just put in straight implants everywhere and the head of the implant is going to be really far back. In those situations where we've got no bone on an x-ray like this, we need to look at more complicated solutions, either sinus grafting or what we call zygomatic implants, which engage into the cheekbone. But this is kind of specialist and it's kind of rare that we need to do this. I mean, we might see about 3 to 4 people a year who need zygomatic implants. So let me show you how we decide how many implants are appropriate for our patients. We start by looking at the smile. The biggest problem that we can have is that if we don't have enough implants going, or the implants aren't as far back as possible, we can end up with these black shadows and you can see a gap behind the last tooth. Okay, this is what we want to avoid. And we have to take into account, number one, our photograph, but secondly, the individual bone distribution. So that we can only do this after taking a CT scan and analyzing on a computer where our most distal, we call it, most posterior implant head is going to go. And looking at the smile as a whole, okay, so the lips. A lot of patients when they come and see us, they won't smile properly because they've learned not to. However, we try and somehow encourage a smile to go as wide as possible because that gives me a visualization. Okay, look, how far back does our final tooth need to go? Now, if we've got an implant going back and it comes out in what's called the premolar region, which is kind of typical and somebody has a wide smile, we can quite often put one extra tooth. That's my comfortable kind of zone. One extra tooth on the final set of teeth that will go further back from the implant. Okay, anything longer than that, you end up with this long lever action, and when we chew and eat, there's more force at the back, and you don't want what's called an unsupported bridge there. So in these situations, if we have a situation where somebody doesn't have so much bone and they do have a particularly wide smile, then we've got more complex solutions. Either we can do sinus lifting to have an implant a bit further back, we can use something called a pterygoid implant in certain situations, but we don't do this for every situation because you can over-engineer, and there are disadvantages to having these implants really far back. I won't cover them in this video, I'll leave that for another video, because the point of this video is just to open your eyes to say that just because someone is promising 6 implants, it doesn't mean you're getting better value for money. There's a ton of research to show that 4 implants is perfect perfectly adequate to support a full arch of teeth. And also, if we try and cram in more implants in a certain space, then it becomes more difficult to clean. You get more inflammation. If we start getting bone loss down one implant, it can easily jump to another implant. So there are disadvantages to having too many implants. The next metric, which is kind of related to this, is the number of teeth. A lot of places are promising you'll get 12 teeth. And I've put out videos on social media saying that typically we give our patients 10 teeth, okay? And then we do get comments from people who are considering this kind of treatment, one comparing us to other places that promise to have 12 teeth, and also people are thinking, how am I ever going to eat anything with just 10 teeth? Let me explain this in a little bit more detail, because the number of teeth doesn't matter. What matters more is the area, the biting surface area that you have, and that is dictated by the kind of the total arch length, let's call it that. If you take the furthest back implant from one side and we just draw a line to the other side, how long is that line? I've mentioned that on the final set of teeth, so if we've got a kind of a zirconia bridge, especially with a metal framework within it, then I'm comfortable going one tooth back from that very last implant. That will give us our arch length, let's say. I don't think that's an actual term, but you know what I mean. And then we can divide that up into however many teeth we want. So if I wanted to inflate this metric, we could just have small teeth and in that same bite surface area. It's not going to improve your chewing ability. The number of teeth is probably more down to the aesthetics. Again, we try and design the smile, and when it comes to the teeth, the function, okay, are you able to eat what you want? That's a given. With 10 teeth, 10 normal sized teeth, anybody can eat anything when they've got fixed set of bridges on their implants. It's really down to the aesthetics and the smile design. So I typically don't promise anything in terms of the number of teeth, okay? In those situations where we've got loads of bone and we can put implants really far back, yes, we're probably going to end up with more teeth in those situations. Can we see those teeth? No, not really. Also, if we put in those pterygoid implants for those patients who have got really wide smiles, we don't have teeth going all the way to the back. Quite often, the last little bit is just exposed metal, which nobody is going to see, but the exposed metal is easier to clean. The next metric that I sometimes see is the number of visits. I mean, this treatment's called teeth in a day, which is extremely deceptive. So quite often, we know roughly how many visits it's going to take, but it can take more. Okay, so every situation is different, okay? I personally don't believe that there is one prescriptive way to doing all-on-4 treatment. There are variations for every single case. For some people, we can take all of our initial records in one go. Sometimes we need to have multiple appointments to take these records. It all depends on the way that patient bites together, the level of gum disease that they have at the outset. There's a whole bunch of variations. This is why we sit down with our patients for 2 hours, and it's me who's sitting down with my patients because I'm doing the treatment. And we try and figure out, okay, what is the end goal? What are the expectations that patient has? What are the things that they can't budge on at all? And what aspects of the treatment do we have flexibility? So for example, I did a video a little while ago saying maybe we shouldn't be rushing our treatment. Maybe instead of taking all the teeth out, implants in, all in one day and having temporaries, there are advantages just to taking the teeth out, having removable dentures, letting the gums heal, and then coming back to doing the implants. However, for some people, this is just not acceptable. Okay, so for those people, we do have to take the teeth out, implants in, and the vast majority of cases are like this. But it's not every single case, okay? And this is why I believe we need to have a personal treatment solution for every single patient, because every single patient is different. Now, looking at the number of visits, there are some places which will limit the number of try-ins that you can have when it comes to making the final kind of bridge work. And this is fine, but this is how they are able to keep costs down, is by just having a hard limit on the number of try-ins a patient can have, because when it comes to making the final teeth, this is an opportunity for a patient to become very particular in what they want. And there is nothing wrong in being particular in what you want. However, you do need to find the right practice which is going to allow you to do that. So one reason people come to us is because we love the aesthetics. We love creating a nice looking smile. Okay, there's art in the implant work and all of that kind of stuff, but no patients are going to see that. Nobody's going to see that on my Instagram. Everyone's grossed out by the blood photos. So the only way of any patient really judging how good the treatment is by how they look in the mirror. And some patients will go home, they'll look at things with a 5x magnifying mirror, and that's just the way they are. I'm a little bit like that, right? I've got really high attention to detail, and if I was spending a whole load of money, I would expect it to look a certain way, okay? It's not the be-all and end-all, but I do like attention to detail. So if you're one of those people, then maybe, check out different places and go to a place where they do emphasize aesthetics a little bit more. The truth is, the vast majority of people are not that kind of person. So if you're in a situation where your teeth are so bad, typically something is better than nothing. And even if you just get a kind of a typical denture look, and dentures don't look terrible, they're absolutely fine. If you want to go from a place where you're really embarrassed by your smile to looking normal, most places are going to be able to do that for you. So what are the metrics which matter more? I would say number one, and I feel I talk about this in every single video, is experience, okay? And there's two areas, because some places you will see the same clinician and they'll take you from literally your initial consultation to your final fit, okay? They'll do all the surgical work and they'll do all of the prosthetic work, which is the making of the teeth, okay? And that's excellent because you've got that one person who you can speak to, that one person who's going on this journey with you. In some places, and I'm involved in these places as well, is that the surgeon will go in, they'll do the implants and give you a temporary set of teeth. And then when it comes to making the final set of teeth, it's another clinician. And there's nothing wrong with this arrangement, but I think it's important that you see someone who has experience, okay? And when it comes to experience, I mean experience in the treatment which you are having. You see, if I was setting up an all-on-4 clinic and we wanted to be kind of as cost-effective as possible, it's a very different strategy, and I would be looking to employing dentists who've got some dental implant experience, and I would train them up to be able to do all-on-4 treatment in the way that I want to do it, and do it well, okay? After a year, they would have a decent amount of experience with all-on-4 treatment. However, it doesn't mean that they're an all-round experienced clinician. So a situation like this where we've got no bone and we need to rebuild the bone and then put implants and then make teeth, this is a completely different skill set to an all-on-4. So depending on your individual situation, I think it's important to ask the clinician, how many cases have they done? Can they show you photos? Can they tell you the stories behind each of these cases? And this goes with the restorative dentist as well, okay? Typically, the restorative bit, the bit of making the teeth, is easier than the surgery, and if that team has been working together for a long time, it's a good sign. I know that for the dentist who I'm placing the implants for and they're doing the restorative work, I'm confident in their ability to do the restorative work really, really well. And I know that if I put my implants in exactly the right place, it's going to make their life easier. Okay, it's like building a house. You need to spend the time on getting the foundations right so that everything else is easier. And another thing which I would highly recommend you do if you're going down this journey is try and figure out what your end goal is, okay? It's not to have X number of implants. Who cares about the number? It's what is this treatment going to do for you? What is it going to let you do that you can't do today, okay? And everybody's different, okay? I try and figure out in every consultation, where does anybody lie on this kind of scale? On one extreme, we've got somebody who wants the ultimate aesthetics. They want to have a smile that looks really natural. I need to figure out what natural means to that individual person. Some people actually don't care about the look of the smile at all. They just want to be able to eat, okay? And where do you fall in this category? Is the aesthetics important? Is the attention to detail important? Because then you're going to have to find a practice that kind of resonates with that, who can understand where you're coming from, because it's a lot of money for a lot of people. So if you want to go down this journey and that is important to you, definitely find a place that has the same values as you. So as always guys, I hope this video has been useful. If you've got any questions, comments, you can leave them all down below. I do read all of them and I will try and respond to anything that needs a response. Okay guys, take care.